A 71-year-old patient named Robert was sitting in my exam room, appearing quite uncomfortable, not in a physical sense, but emotionally. At last he spoke up. Dr. Morgan, I've been handling things the same way since I was 20, but lately it doesn't feel right and I'm worried something's gone wrong. Nothing was actually broken, yet 50 years of repeating the same habit had been gradually harming his prostate health, his nerve sensitivity, his vascular function, and he had no idea it was occurring. The habit, his masturbation technique, was causing damage that could have been prevented and can still be fixed, but only if we openly discuss it. I'm Dr. Sophie Morgan, a board-certified urologist with more than 10 years of experience helping men over 50 preserve their vitality, their function, their dignity. No judgment here, no prescriptions, just straightforward, honest guidance. You've probably heard that masturbation is beneficial for you, and indeed it can be. But after age 60, the manner in which you do it becomes far more important than whether you do it at all. Small errors in technique, improper timing, too much force, these can quietly erode your prostate, your circulation, your overall sexual health. Today, I'm going to reveal 7 common masturbation mistakes that silently damage older men, along with the precise adjustments to make before any permanent harm takes hold. Mistake number 6 is the one that astonishes every man I share it with. Before we dive in, please subscribe and tap that bell, then comment below. Where are you tuning in from today? Canada, the United Kingdom, Bangladesh, Brazil, Malaysia. I truly enjoy connecting with men around the world who refuse to view decline as unavoidable. Now, let's start with mistake number 1, and it's probably not what you're expecting. Mistake number 1, relying on pornography as your main source of stimulation. So many men over 60 share the exact same concern with me. Nothing arouses me anymore. Is this simply aging? My response is always the same. No, this is overstimulation. Here's the biological explanation. After 60, your dopamine system, the one responsible for generating feelings of pleasure, begins to slow down. It requires more time to recover between stimulation sessions. Yet modern pornography provides endless, rapid novelty. Your brain becomes overloaded and defends itself by desensitizing your pleasure receptors. The outcome: real physical touch starts feeling bland. Intimacy seems unexciting. You find yourself needing ever more extreme material just to experience anything. And in time, even that ceases to work on an emotional level. You begin feeling detached from yourself, from your partner, from pleasure altogether. The solution: 14 days without screens. Relearn how to become aroused through pure sensation. Touch, breathing, full presence. Your dopamine system will recalibrate, and natural pleasure will come back. Now, let's address the place where a lot of men decide to do this, and why that spot is actually causing genuine harm. Mistake number 2: masturbating while seated on the toilet. I get the reasoning: privacy, a door that locks, 0 interruptions. It seems practical, but from an anatomical standpoint, it's problematic. Here's the issue. When you hunch forward on a hard surface for a prolonged period, you compress the blood vessels that supply your pelvic area. And after 60, circulation to that region becomes absolutely vital. It supports prostate health, erectile function, bladder control, everything. But that seated posture restricts blood flow right when you're stimulating the area. Over months and years, this leads to chronic pelvic tension, a weaker urinary stream, challenges with arousal, even unexplained groin discomfort. Tell me, have you ever masturbated on the toilet? If yes, drop a 1. If no, drop a 0. I'm interested to see how common this is. The fix is simple: stand up, recline, or lie down. any position that avoids compressing your pelvis. Allow your body the circulation it requires. This naturally leads to mistake 3, which impacts nearly every man. Mistake number 3, hurrying through the entire experience. Many men approach this like a routine task. Get in, finish quickly, move on. But here's what that haste does to your body. When you rush, your body releases stress hormones. Your heart races. Blood vessels tighten. You're activating fight or flight mode instead of the relaxation response your body needs to gain hormonal benefits. No oxytocin is released. No profound satisfaction is registered. You may reach climax, but your nervous system doesn't recover. You end up feeling drained rather than energized. Emotionally, rushing trains your brain to view pleasure as something to get through, not savor. Over time, interest fades, sensation diminishes, connection vanishes. Here's my advice to every patient: slow down. View this as restoration, not a duty. Your aging nervous system thrives on gentle, prolonged stimulation. Give it time, give it focus. Everything gets better when you stop hurrying. Now, here's an aspect most men have never thought about: a muscle group you can't see, yet it controls everything that matters to you. Mistake number 4, neglecting the pelvic floor muscles. Most men aren't even aware they have a pelvic floor, but it's the base supporting your bladder, prostate, and sexual organs. It governs urinary flow, erection strength, ejaculation control, all of it. The issue? Most men never activate these muscles during self-pleasure. Worse, some strain or push downward, which gradually weakens them. After years of this, you can develop weaker erections, urinary leakage, reduced sensation, and no clue as to the cause. The solution is straightforward yet transformative. During arousal, contract the muscles you'd use to halt urination. Hold for 3 to 5 seconds. Release. Repeat. This builds pelvic floor strength, heightens nerve activation, enhances blood flow. Do it regularly, and in just weeks, you'll notice improved control, heightened sensation, greater confidence. It truly works. I witness it all the time. And this brings us to the question every man ponders but rarely voices aloud. Mistake number 5, getting the frequency totally wrong. Some men do it every day and fear they're overdoing it. Others go weeks without and question if that's okay. The reality, both extremes often create issues. Too frequently, and your prostate gets irritated. Testosterone doesn't recover properly. Energy levels drop. Pleasure turns routine rather than restorative. Too infrequently, and circulation stagnates. Nerve pathways fade. Tissue loses its elasticity. Your body is meant for regular activity, not extended inactivity. From years of clinical practice, here's what suits most men over 60, 1 to 2 times per week. Intentional, not compulsive, mindful, not automatic. That frequency helps maintain hormonal balance, keeps circulation robust, supports prostate health. But remember, this isn't a strict rule, it's a guideline. Listen to your body, it will signal what it truly needs. Even with ideal frequency, however, this next mistake can ruin everything. And yes, this is the one I teased earlier that shocks every single man. Mistake number 6, using too much pressure or force. As natural sensitivity decreases with age, the natural response is to compensate. Grip tighter, press harder, use rougher textures. It feels logical, but it's harmful. The nerves in the penis are extremely delicate. Excessive pressure over time leads to tiny tears, scar tissue buildup, loss of elasticity. Some men develop Peyronie's disease, causing curvature. Others gradually lose sensation, not due to aging, but from self-inflicted mechanical trauma. Emotionally, this shifts how you experience pleasure. It becomes something you force out rather than gently receive. That approach blocks the hormones and blood flow needed for true satisfaction. The answer, gentleness, always. Your body responds to care, not force. Treat yourself as you'd want a partner to treat you. Quick poll. Does gentle pressure feel right to you? Comment 5. Or do you think more intensity is needed? Comment 6. I'd love to hear. Now, the last mistake. This one isn't about technique, it's about mindset, and it may be the most crucial. Mistake number 7, masturbating without any emotional connection or intention. Far too many men become disconnected over time. Self-pleasure turns mechanical, emotionless, devoid of joy. They do it out of habit rather than desire, from loneliness rather than connection. When you strip away emotion, you also strip away its healing potential. Oxytocin doesn't flow. Dopamine doesn't recharge motivation. You finish feeling hollow instead of whole. That emptiness isn't aging, it's absence. Absence of presence, gratitude, intention. Even solo pleasure can be meaningful. It can be a moment to appreciate your body, your aliveness, your capacity to feel. When you bring awareness back to touch, when you approach it with purpose rather than escape, your whole system responds differently. Healing occurs that no pill can replicate. Let me lay out the full roadmap for you now. On step away from screens. Rebuild sensitivity through actual sensation, not digital input. 2. Change your setting. No more toilet. Choose positions that promote blood flow. 3. Slow your pace entirely. Turn it into meditation, not a checkbox. 4. Actively engage your pelvic floor. Contract and release throughout to gain strength. 5. Find your rhythm. 1 to 2 times weekly keeps balance for most men. 6. Stick to gentle touch only. Force harms. Gentleness restores. 7. Bring full presence, emotion, gratitude, breath. These magnify every benefit. You need to know this. You're not broken. You're not beyond your prime. Your vitality isn't vanishing. Your body is just requesting a new approach. More awareness, more intention, more respect for its current needs. Give it that and see the transformation. Sensation returns, confidence rebuilds. Connection with yourself or another feels vibrant again. Aging doesn't terminate your vitality. It simply alters the route to it. Slow down. Pay attention. Your body remains capable. You just need to respect how it operates now. If this spoke to you, please hit like. Share it with another man who could benefit. And subscribe to Dr. Sophie Morgan for weekly medical insights that help you stay strong, functional, and confident at any age. In the comments, tell me which of these 7 mistakes you recognized in yourself. I'm Dr. Sophie Morgan. I'll see you next time. Remember, your best years aren't behind you. They're unfolding right now.